Well, thank you very much. Nordine Fried had some of these data, and this is the question everybody's asking. How could this possibly work? Because when I first saw this 5 years ago, and Michelle and Ree talked to me about it, I said, you have to be crazy to think this technique's going to work. But now I know it does work. And these are some important pieces of information that are just becoming available now. They're being presented at some of the vascular conferences. So I just thought I'd run through this a little bit for you. The French registry includes 54 patients, 6 arches, 5 descending, 5 dissections, 28 thoracoabdominals, and 8 abdominals. This is just the characteristics of these patients. Not going to get into that, but just to give you some idea of what the patients look like in terms of their, and you can just read this as I come down rather than go through it for you, because it is, this is the classification. Most of these were in class 4 and 3, and then up in 1, not too many in 2. The 55 implanted mean 2 per patient, and you can see from the previous presentation here that the majorities will have more than one stent. All-cause mortality, you see here, none at 30 days, no aneurysm-related mortality, 1 adverse event. I'll just go on and show you this. Branch patency, this is extremely important. If you look in the right-hand column at 12 months, there's branch patency is positive in all the patients studied at that time. There have been no, that I know of in this study, there have been no occlusions of branches except in a case where the lesion, a narrow lesion, was not taken care of prior to that. In the arch, 6 were de novo. 1 was to correct a previous stent. The fusiform, saccular, this just shows the size, typical of these characteristics. Once again, here are the results here. No major events, no migration, no fracture, no rupture. The main vessel and all covered branches are maintained 100% of the cases. Branch patency, one more time here, in those patients followed up, no compromise on branch patency. In the aneurysms, 7 fusiform, 1 saccular. These are sizes, I'll show you that. 8 branches in landing zone, 7 within the aneurysm. Adverse effects, no migration, no fracture, no rupture. Main vessel, all covered branches are patent. 12-month follow-up in those 3 patients, excluded at 3 months, 1 month, and 12-month, stable, decreased, and stable. No patient showed any expansion. At 6 months, 3 patients excluded, 1, 2, and 3 all stable, and 1 month at that patient. Now, there is another major study that in Paris under the French Ministry of Health that's under adjudication right now. I can't give you the data because it is not available, except I do know that in these 23 patients, thoracoabdominal aneurysms, no aneurysm-related death, no paraplegia or paraparesis, and that's true throughout all of the French register we have. There's been no neurologic event. And using a parallel group in one of the another corporate-sponsored parallel group that would match this cohort of patients, there's a 16.4% paraplegia rate, and in this, none whatsoever. And those data are going to be coming available very soon. And 100% branch and main body, and no migration, and no aneurysm rupture, aneurysm complete or progressive at 100% of the patients. So in conclusion, I think that the data now, the hard data that we're getting available to us, are really answering the question that the multilayer flow modulator does indeed maintain patency of the aneurysm and the closing the aneurysm thrombosis, and maintain patency of the peripheral branches. Thank you very much.